Okay, this second segment that we're going to be discussing starts off with a discussion on blood pressure. Now, I'm sure that all of us have been to the doctor's office before, and when you get there, the nurse takes your blood pressure and she gives you a couple numbers, say 110/70. The whole idea about this section is what exactly do those numbers mean when we say them? All right, that's what we're going to kind of be exploring. What exactly do they mean? And you may know a little bit about this, but you may not know everything in terms of exactly what it does translate to. Blood pressure is based on the contraction and relaxation of the ventricles. So this is simply a ventricular thing. It's mostly actually based on the contraction and relaxation of the left ventricle, because we measure blood pressure once the blood has come out into what we call the systemic system. The contraction is called systole, and the relaxation is called diastole. So when ventricles contract, it creates something called systole, and relaxation is referred to as diastole. That's why sometimes you'll see on shows like Grey's Anatomy or ER, if people are having a heart stoppage during a surgery, they will refer to it as asystole, because that A in front of the word systole means basically their heart's not contracting. And it's a kind of a quick way that they can say, okay, it's still not beating yet. Now that translates to blood pressure, because systolic pressure is the peak pressure, that first number that we have, and it happens during the contraction cycle for the ventricle. Whereas the diastolic pressure is that minimum pressure that happens when the ventricles are relaxing, and that is the second number that we see. Now the difference between the two numbers is referred to as the pulse pressure. So in other words, how much pressure your heart actually is able to generate. Now blood pressure is only measured in the arteries because what happens is the pressure as you move through the capillaries and veins continuously drops off. And you can actually see this here on this diagram. We get this alternating systolic and diastolic pressure in the arteries, but once we get to the arterioles and into the capillaries and veins, it just simply drops off to almost nothing, like I talked about when we get back to the heart. Now, how measurement of blood pressure actually works is when that nurse or doctor inflates that cuff on your arm, the pressure on the outside actually collapses your brachial artery in your arm. And what they do is they do that up to a certain point, and then they start slowly releasing that air pressure. What they're then listening for is the start of like this heartbeat sound. And when that heartbeat sound hits, what's happening is the blood is actually kind of surging back, surging forward and then slowing down, surging forward and slowing down inside of your artery. And so they can actually hear that, and it's in time with your heartbeat, because as your heart continues to push, it pushes it through kind of into that empty space. When that noise goes away, they know the vessel has refilled, and at that pressure would be your diastolic pressure. So when they start hearing the sound, they note that time on the little gauge, or not that time, but that pressure reading on the little gauge. And then when they stop hearing it, they also note that pressure. So that gives you your two numbers. Now, there are some differences in terms of our circulation through the heart and the surrounding areas before we are born, and that is referred to as fetal circulation. And the reason why that happens is because before birth, our lungs actually don't function. So there is very little blood flow to our lungs. Now, the blood is actually able, though, to bypass our lungs in two different ways. Remember, the baby's not breathing. They're in a liquid environment. They're actually getting oxygen exchanged at the placenta. That kind of acts as their lung while they are in utero. So in order to keep the blood volume up appropriately but still circulate it, the blood actually bypasses the lungs, and there's two methods. First is a hole called the foramen ovale. Basically that means oval hole, and that's the opening between the left and the right atria. The second one is kind of a shortcut between the pulmonary trunk, the pulmonary arteries, and the aorta. So blood comes out of the right ventricle and pumps up into the pulmonary trunk, and then into the aorta. Okay, sorry about that. Somebody came in. And you can actually see the pictures of this here on this diagram that actually came from your book. So this is coming from the placenta here, and you can see it's red, so it's oxygen-rich blood, and it combines with the oxygen-poor blood coming in, and then it goes through the foraminal valley, which will actually kind of shortcut it over to the left-hand side and then up and out of the heart. But there is still some that comes down into the right ventricle and is trying to go to the lungs. So it instead takes this little shortcut here between the pulmonary artery and the aorta. Now, once you are born and you actually take your first breath, this starts to change. With the first breath, the pulmonary vessels do expand, so they actually take on some of that blood volume that was tied up with the blood circulation to and from the placenta. These are the two important changes, though, that happen in terms of the heart and the surrounding areas. That ductus arteriosus actually constricts down, and it becomes a new structure. It's called the ligamentum arteriosum. In addition, the foramen ovale closes. If this does not happen within a few days of birth, it does require some surgery. Okay? All right, and I think what we have left to do is the conducting system of the heart, and I've got a couple of worksheets that are also on here that if you haven't already checked out, you need to.